the patient get out of the hospital. What happens is if your worker who is responsible for feeding that information is not well trained, he may skip some of the information, or maybe a slight mistake, AM, PM, that actually makes a huge difference, right? So that's why I was telling you that it takes most of your time to analyze, to profile your data, to make it appropriate for you to able to be analyze it, and to be able to get something productive out of it, something that will help you to make informative decisions. Like, you all will be going to be healthcare leaders someday, and you'll want your data analyst to bring a report in front of you where you can see that, okay, this department is not performing as per targets, I need to take some steps. So you have to set your targets, you need actuals, and you need to compare those two. If you will have missing informations, or if you will just keep analyzing with whatever rough raw information you have, you will never be able to make informed business decisions. That's how it is very important to understand healthcare data and to keep yourself involved in the basic step in profiling and making your data of quality that you will be able to analyze. And I'm telling you, if you have a structured data, after spending that lot of time, it it only takes like 20% of your time to create tables, create visualizations, create reports that will be of value to your business, right? So big data, as name suggests, it's large, huge volume of data that's coming to you. This data is not always clean because it goes through multiple hands. Why? It's a challenge in healthcare industry because healthcare industry keeps on changing. It keeps on evolving. It's the most evolving industry, I would say, in today's date. Every day after COVID, you would have seen how constantly, how rapidly we have changed, how rapidly our healthcare seeking behavior has changed, right? So these all result in changing of the data and changing of the functioning of that industry, and also in changing of the data that you are generating at all levels. Again, like I think while introducing, we were talking, and sir mentioned about social media. We all have a habit of just sharing a post. I'm going to lunch, I'm going for a walk, okay, I just got a new phone. um, I have seen people sharing up their health information as well. They share pictures of their Fitbits, their Apple Watches, what they're doing. They're giving out their health information to the world. And that is a security threat. That is a threat to patient privacy and security. And why these data is not regulated? Because Apple doesn't think about your healthcare privacy. When they design a watch, the most important point for them is to think about the functionality of that watch. It's up to you how to use it. And a common man is like, if you're studying health informatics, if you're studying data science, then only you will study about privacy and security laws related to healthcare data, right? Or any other data. If you are a simple common layman, you will not know, and unknowingly you will give out your health information to people out there who are there in your systems and making use of your information. Again, I'll ask you one question. What do you think how much healthcare data cost? What's the cost of healthcare data? Supposedly, if an organization is doing some kind of research and gathering information from various levels, how much the organization is willing to pay the other organization that's gathering all those information.
I think
And
unicorns are creating the more value. They are using the most of data of our healthcare. So maybe it goes to billions.
correct, it's huge cost involved with sharing all these informations. And all these industries like Apple, Google, the giants with these data lakes, they'll pay you money to get your healthcare data. But the way you share your information, there are laws governing how you share your information. You cannot just take out a file out of your EHR system and give it to a research organization. There are laws governing identification and de identification of data. The drawback is in India, we still do not have that system. And that is a great threat where we need to work on, where we need to have a law that is specifically designed to secure patient health information. So, moving forward, I'll just talk about the levels the healthcare data goes on changing. This is a health data pyramid. In any health informatics book you will choose to read, this is the most common pyramid you will see. It is called DIKW. I know W is missing, why I'll tell you. So, data is the raw information. It can be from some electronic records, it can be paper based. But when you profile your data, when you clean it, when you keep it in a table form, or if you organize it, if you structure your data, it becomes some kind of information. You are able to read through those cells, through those columns, through those rows, and you are able to make out something out of those numbers. If I'll give you a name, Ruchi Mishra, if I'll give you North Carolina, it doesn't matter to you, right? But if I keep it in a structured format, name Ruchi Mishra, place North Carolina, city Charlotte, it gives you some information, right? Similarly, a set of information well structured give you some kind of knowledge. Maybe you are having a database of the residents of North Carolina. Maybe you are having a database of the patients visiting your hospital. Then there can be different groups, there can be departments, right? So in that way, when you keep your data clean and keep it analyzed, structured, you are going a level up, data to information and then to knowledge. And when you are able to make best use of the knowledge from your numbers, that's when you achieve wisdom. So the W that's missing is wisdom, because not always we are able to reach to that point. Why? We have to set back our clocks to data profiling at some point. Maybe you got a new information. Maybe you need to add a row. Maybe you need to delete a column. So it's going up and then coming down. So it's not always easy, but it's not that difficult as I'm making it sound. So, yeah. Moving ahead, I'll talk about health informatics. So it may sound very new field to you, but it's old. It's very old. It came into light in 1968, if you will believe me. The only reason we are talking about health informatics a lot these days is now with a lot of numbers of these data that is available everywhere, we are recognizing a need of a structured system where we can use that system to read our information and to make some productive use out of it that we can use for our business decision making purposes. So, health informatics, what it does, it aims to make effective use of information, like I said. And what it does, if you are able to analyze your data and make information out of it that you need, you will be able to better deliver a quality healthcare system to the people of the country. And there are different types of this data. There is administrative data. Administrative data is the information that comes from your administration, right? How many doctors are working in your hospital, how many nurses are working in your hospital, like that, that kind of information. Clinical data is patient related data. How many number of patients for which disease is coming to your hospital? What is the correlation between a patient having diabetes and increased risk of a cardiac arrest, right? So these kind of information falls under the category of clinical data. The lab information, your radiology, this all falls under this category of clinical data. Then financial data. In US, this financial data is mostly used for insurance purposes because US is the healthcare system in US is hugely, or maybe it's not wrong to say completely insurance driven. But in India, it's not the case. We have various government programs that pays for BPL persons to seek proper healthcare, right? So those financial information will fall under the category of financial data. And from where we get all these information? From our health records, from information exchange. Information exchange is exchange of information between one source to another. That can be between a computer system to another computer system, between one organization to other organization, to maintain interoperability, to maintain continuity of care, right? Then there are data warehouses. There are organizations that store your data, and also social media. You share information, it stays there. And how you store it? In form of medical records, they can be paper based, they can be electronic records. EHR is still not as prevalent in India as it's in US. In here we have huge EHR systems that have all the patient information, the financial information, the productivity information, and the number of data they are generating day by day is huge. So storage is always an issue when it comes to any industry that's storing your information, and that's why cloud is like talk of the day. Even in your iPhone, you have to purchase cloud space. Google, you have to purchase cloud space, right? So cloud industry in data storage, that's the reason why it's growing. Now, okay, let me talk about personal health information. So personal health information comes from various sources. Like it can be from a public health source, and when it comes from a public health source, it's public health data. And what's public health data is? It's the information about your demography, your socioeconomic conditions. What are your cultural beliefs? What are your health seeking behavior practices that you follow? Your education, right? All these come under public health data. Health research data is what the researchers go out and they gather for their research studies. And personal health data is the important one, like all of anything that is health related, anything that has that personal and private component in it is very sensitive information. So personal health related information are the information that are linked to one individual, that makes you identifiable, right? So these information must be protected at any cost. There are laws in countries like US, HIPAA. There are laws in countries like Canada, PITA, and one more, PIPFA. And there are laws that govern European Union. Like you must have seen the cookies thing pop up when you open a website. So they save that cookies just to track that what information you are taking up, and you have to follow the rules. You cannot share the information, right? So all these information are gathered and stored in a place. So healthcare information is, like I said, any information is the processed data, a structured data that gives you some kind of knowledge about your organization or about the subject that you are trying to deal with. And I think I have touched this thing that missing data is the most concern that we are dealing with every day in our projects, and we have to spend hours making our data presentable and making it to be used for further analysis, for visualization, right? Again, I think by now you all must have understood that how important healthcare data is, how important managing that information at every level is, and how important it is to keep your data clean so that you'll be able to analyze it to give you better business results. And that's why you have to follow privacy security concerns, because you cannot just, like any other industry, you cannot just go and share your health information with patients. There are strict laws in countries that can lead you to lose your job, that can keep your reputation at stake, and that can even put you behind the bars. And that's why it is important to, whenever you are dealing with any numbers, it's very important to follow the laws of that country. One most common standard that we follow when we want to see the quality of your data, of your numbers, is ISO. We all know about it, right? In healthcare, there are different standards that we follow to make our data presentable and of quality. HL7 and FIRE are two topics that, if I'll talk about, will take another 1 hour. I would really suggest you all to search about HL7. FIRE is FHIR, and read about it. So that's what is the standards that we follow to for ETL purposes to make our data interoperable, right? So why is privacy and security important when you work in data analytics? Why it is important? Because you are dealing with sensitive patient information, and it's more important when you share that information to third parties. What are these third parties? The third parties may be the research agencies. For example, during the past few years, when the pandemic hit, there are large database of patients who are COVID positive. So their information, maybe if, for example, a research agency wants their information for some kind of research purposes, maybe a pharmaceutical company wants their information to develop a new drug, you cannot just give it to them. You have to follow certain steps to share that information to these third parties. You have to follow the regulations in whatever country you're working in, right? So these are sensitive informations, and when you share that information within department, then also you have to follow these regulations. And outside department, it's become more important to follow the regulations. So a department may be a doctor who is dealing with a patient, maybe a diabetic patient, and that patient develops over the time a renal disorder and it goes to a different doctor in a different clinic. To maintain the continuity of care, you share that information to other clinic. You pass on that information to other clinic. While doing so, you have to be very careful that you will not share any sensitive information without patient's knowledge. And you have to follow the HIPAA rules if you're working in US or any agency that is HIPAA compliance. You have to follow those rules. Why it is important? Because it may lead to identity theft. Someone can steal your identity. That's very common. There are people out there sitting in their computers trying to hack your information and use it for their benefit. That's why it's always important to de-identify your information. There are certain sets of information that when you transfer for your treatment purpose, you have to make it identifiable, right? The patient name will be there. One doctor who is transferring or referring a patient to the other doctor, they'll give certain information about a patient so that the other doctor will know that it's the same patient coming to my clinic and referred there. So you have to follow those regulations. What is de-identified data? De-identified data is most important. There are certain identifiers that link that information to one person. There can be n number of Ruchi Mishra around the world. But if I link my name to my date of birth, to my place of birth, that makes it information identifiable. That links it to me, right? So if I have to share my information with someone, I cannot just share these three together. I have to make it I have to de-identify that information. So, for example, you are selling your database to a research organization. What you will do? You will de-identify that data. You will never give real patient names. You will never give their real age. That will link those information to one person. They are MRNs. You have to make those MRNs because that single MRN will connect you to your database. You have to de-identify it. You have to make it a test number, a random number that will keep your data secure. At the same time, the research organizations can use that information for a larger good, right? I have already talked about the cost that is related to health information, and that's the reason some bad guys out there try to steal your information because they don't want to pay you that money, right? And when your data is de-identified, your data is secure, you can save yourself from that identity threat. So, whenever any patient is coming to your hospital and giving you any kind of information related to him or her, you have to make certain disclosures. Okay, we are recording these informations. We may need to share it with other doctors, other clinics. We are doing so, we are letting you know. These are the laws that our organization follow. You will be covered
Binsi?
under these laws, and we will never use your information without telling you or We will never use your sensitive information. Every industries follow it. When you make a Gmail account and then you give your information to that system, you will see the pop-ups there, that a little disclaimer that we will not share your information to third parties for whatever. So that's called the disclosure. And every patient has got a right to know when and where their information is being used, maybe for future research. Some patients they have right to decline you the right to share their information, and if they do so, it's your obligation not to share information for such patients. That's why you take consent. That's why you describe them everything. Maybe in a paper, maybe in an email where you send them your privacy policies and they read it and they sign it.
Come here
And
once.
then they authorize it whether they want you to use their information or not. So that's where informed consent comes into play.
पिक ले लो अपने मोबाइल से.
The thing that sometimes get messy is ethics. Why so? Let me give you an example. For example, there is a pharmaceutical company that
And
wants
close
your
this
blood
gate na
samples, right?
after this.
And they want your blood sample to be stored for a particular number of period, like maybe for 5 years or so.
इधर से.
So they tell you that they are going to take your blood sample and they are going to store it and they are
Take
going
only
to
this
use it
much,
for
huh?
the
Don't take
study.
the back side.
Why that blood sample is important? You cannot,
I will
like,
crop it, no problem.
the labs, they cannot just give your blood samples away to anyone. What makes your blood sample
Take 2 3,
identifiable?
2 3.
Your DNA, right? So there are banks that store that information. And DNA is one thing that can never be de-identified. So every patient has got that right to say a yes or no to participate in that study for that pharmaceutical firm. And if they say no, you cannot share the information. But for example, if you're suffering from a rare disease, if your blood sample can be used to develop a drug that will save around 80% of that population from getting diagnosed with that condition, what will you do? Ethics is like doing good for everyone, right? By giving a simple drop of your blood, you can save about 80% of the world population. But that one information is making you identifiable. That one information is keeping you at risk of identity theft. What happened at time of COVID? We all were very skeptical of sharing that information that, oh, I was positive. Why? Because my neighbors will not talk to me. But at the same time, if you will not tell your neighbors, they may come in contact with you and get infected. That's why ethics sometimes in healthcare get very, very confusing of what's right and what's wrong. And that's when patient's autonomy come into play. Larger good, good. But whose decision it is? It's patient decision. And that is why it's very important to inform your patients of your organization's policies, disclose what you are going to do with their health information or their personal information, and they have the say what to do and what not to do. And that is why it is very, very, very difficult when it comes to make laws governing your personal health information. And that is the main reason that I believe countries like India are struggling to have a specific law in place, right? Now, there are still some laws in place. There are still some policies, some acts that India is following, like Information Technology Act. I have given links where, or you can just Google about it, because all these laws, and if I want to talk in detail, would take another half an hour or 1 hour. So, what happens with IT Act is IT Act is a generalized act. There's a there's a section that also applies to healthcare where any entity here refers to anywhere you are saving your health information, maybe computer systems. So any entity that contains your personal data, they must maintain certain security practices. A simple example is in a hospital, if you are working in data entry, if you are managing your EHR system, you can never share a password with your coworkers, right? So this is just an example. There are n number of security laws that goes with it. You cannot, even for your family members, you cannot just say, "Oh, mom, you want this information? I'll just go to office and bring it." No, you cannot do it. There are steps. You need to get a form filled. Maybe they need to request some information. You have to get it approved, and then you are able to hand over that information from their patient, because every patient has a right to their own information. If their data is in your hospital, they have got all rights to get that information from your system. But you cannot just click, take a printout, and give it to them. You have to follow all the security measures that are written there in your organization policy that relates to patient information, right? Same, if there is any mishappening that is related to private information of patients, that entity is liable to pay damages. And in countries like USA, this compensation is huge. There have been instances where companies had to pay millions of dollars as compensation where a security was compromised. Then there are certain sensitive data. Like, if you will, I really recommend you to go and search HIPAA and search de-identified information in HIPAA. There are 18 de-identifiers, 18 set of information where you have to follow those information to make your data de-identified, right? Similarly, in India, there are sensitive data. It's termed as sensitive data. So any financial information, any information related to your healthcare conditions, these come under the category of sensitive information. So there are 6 main components that makes that information identifier. So India is trying to come up with personal health data protection bill. The latest update is they need to make some changes in that particular bill, and they are going to maybe start working on it in a phased manner. I would suggest you to go ahead and specifically read about personal health protection bill in India. Another thing that is similar to HIPAA in US in India is DISHA, and that's regulated by National NEHA, that's National Electronic Health Authority. If I'm not wrong, I'm sorry, I'm forgetting the full form. So it's NEHA that regulates Digital Information Security Healthcare Act, and that is something very similar to HIPAA in US. That will help us to at least have a system where we'll be able to design some security practices and govern our health related information. But I'm telling you this thing again, because of complexity that comes with health information, every industry wants your healthcare information. Coming up with a law that is specifically designed for your healthcare system is challenging. So that's not impossible, it's challenging. And we have to go to reach that role, to reach that goal in a phased manner. So these are the privacy laws or privacy policies that are in place right now. And I'm giving you some links. So short period of time, right? So I was only able to read through these three. There are many. If you will Google it, there are many. I would suggest you to follow the ones that are maybe published in some kind of source, authentic source, like maybe a health journal or some NHM websites, or if you will go to CDC in US or National Health Authority of Europe, you'll find a number of information on health privacy. And at least, if not specific laws, if you are interested in, you will find various information that will help you understand how health information is governed globally and how important it is to follow the rules when it comes to working with healthcare or healthcare information. So that's what I have for you all today. Thank you, and any questions?
Yes, so students, you can ask if there is any query, any question you would like to ask. Please go ahead, don't shy. Okay, one thing I would like to ask, Ruchi, as far as like in India, now netmeds and there are so many online companies, they are providing drugs and medicines on demand, and sometimes they ask to share our prescription. So do you really think that government should allow such companies freely to access our information? And I hope you're understanding what I'm asking.
So, a prescription, as long as it does not connects a person to that information, if it does not have your name, your address, just the disease and what prescription. So that's a very general information for, like, you can Google, for example, say for asthma, you can Google and you'll get a list of prescriptions. So this is information that is available in public domain. But anything that connects that information to one specific person makes it identifiable. And that's where the threats come in of you will never want to share that information. And government, I believe, cannot force you to share that information. That's where I talked about autonomy. So Let me give you an example. COVID-19 vaccine. It's not mandatory. We all have been through pandemic that's taken lives. We all know how important COVID-19 vaccine is. But that's where patient autonomy comes into play, whether they want to take COVID-19 medicine or not. We all know that it's for larger good. Ultimarium response, but no. Patient autonomy comes here to play. A patient has got all the right to say a yes and a no. So you can share your prescription as long as it's generalized and not make anything connected to a patient. So I think
Yeah.
if I am able to answer your question.
Absolutely, absolutely. You're absolutely
Yeah.
right. Like the amount of information we are sharing, if it's general, like, so definitely there is no, you can say, danger to our identity, right? And one more thing I would like to ask, there is a kind of feeling of discrimination. Like even some relatives are in New Jersey, they are in medical field from my wife's side, so they used to say that they are not guinea pig, they will not allow government to do practice or experiment on them. So but somehow in airports and in immigration we have to disclose it, we have to show our like vaccination card or certificate. So it's a kind of discrimination is there, like if we are not vaccinated, so we are being treated in some abnormal manner.
I would say depends upon individual thinking. The discrimination here, if you are specifically talking about ask airports asking for your vaccination record, I don't personally think it's a discrimination because you are trying to stop the spread, right? Discrimination comes when suppose your neighbor is COVID positive and you know that and you start behaving differently with that person. That's what discrimination is. So that's something where ethics come into play. So you have to understand that it's common these days. People are getting infected. We have vaccines now. We have come a way where patients are getting treated. They are going home all healthy. So that's where ethics comes into play. That's where personal preferences or personal behavior comes into play. Health informatics is your information, your numbers, your data. So healthcare laws will, these informatics laws will not stop you for thinking in a way about a specific person, right? That's how your ethics allow you to think, your ethics allow you to behave with a person. And honestly, I think we all have grew up during these 3 years of pandemic. We all have faced those challenges and are more cooperative now, and we are more humane, I would say.
Absolutely, absolutely, you're right. It's really a matter of ethics and it's about your own personal choice. Okay, so now I would request to students to ask questions. We are having just 2 minutes more. आप लोगों में से
Hello.
yeah, please go ahead.
Yes, ma'am. Ma'am, we all know that we have access to urban areas if we are talking about the data. But what about the rural areas? Because what are the challenges that we don't have access to rural areas?
So, in India, rural health is mostly governed by the government. So, what happens is you, it's been 12, 13 years now. I'm forgetting the name of that form, but every subcenter has to fill a form where they provide you all information about the health conditions of that particular village. So you have immunization information, You have a electronic health system in India in place, that is RIMS. So you have your immunization information. NRHM played a very important role. You now have computers even in sub-centers, and they have trained ANMs, they have appointed data entry operators. So you do have access to that information. It's just that, like I said, you cannot have that information handy. Like you cannot just go to a sub center and ask their information. You need permissions to work with that information, and that comes with the government. So if you are working at a district level, you need to go to the CDHO office and they'll see your condition. Maybe you want to do a research study and you want that rural health information. You have to go to some steps to get those permissions to be able to access that data, right? The challenge is the ANM who is entering those information in maybe the paper form and electric form is not well aware of de-identification. So the data that will come to your hand will be raw data, will be the actual real data. So it's your responsibility when you analyze that data, when you start working that data, to make it de-identifiable. It's not very easily available to you, but it is available. There are systems in place at rural level, and all thanks to NHM, that gives you access to those information. But you need to have certain permissions to get that.
Got it, ma'am. Ma'am means that digitalization is the solution last in the land in the end.
That's a very tricky question, I would say. With digitalization, there are huge responsibilities, right? I told you about privacy, I told you about security. And the most important, I'd say the biggest challenge will be, especially in India, the storage of information. If you remember that triangle that I showed you in the first slide, just imagine how many subcenters are there, the basic, the grassroots level of Indian healthcare system from where you're starting to get that data. Imagine the size of numbers. Where will you store it? So, if you want to digitalize everything, you have to be well prepared. On the other hand, it helps a lot to transfer your information from one hospital to another hospital. That's what is called continuum of care. I'll give you a very simple example, right? Maybe you are in a town where you have limited healthcare and you have to get a surgery done. You need to go to a metro. You It will be very easier if you have all your information digitalized. The doctor will just in a click can share information from that town level hospital to a multi specialty hospital in a metro. That's how easy it is for continuum of care. But one information from one computer system reaching to another computer system is, again, this hospital may have some privacy policies in place that may hinder transferring all of the information to this hospital. The issue is, in India, we don't have that system.
Thank you, thank you.
You, yeah, NHM gave computers to most of the subcenters, to most of the PSCs, but the doctors there are busy in treatment. We know we have a crunch of medical doctors in India. The data entry operators, they don't
Okay, ready?
they are not very well trained to handle these information, right? With this presentation, now you know how important every number is. You have to do extensive training at each and every level to reach to that digitalization point. Again, it is important, but it is challenging and it can be done.
Ma'am,
Surely.
you said that one surgery has to be done. So I think Pristine Care is doing the same.
Uh, as long as I know, there are private hospitals that have that system in place. I think we still have to work to make us to strengthen our public health system. Money.
Absolutely. Absolutely.
Right, ma'am.
ओके सो थैंक यू सो मच रुचि इट्स ऑलरेडी 12:30 आपने कल शुरू किया था आज ख़त्म किया है
Ma'am, I have one question.
या
Yeah.
May I ask?
या
Ma'am,
प्लीज़
as
Yeah.
I was working in NHM from last 3 years, ma'am, in the ground reality, like you said, we have need to collect the raw data, which we have to correct or precise after to make it identified and to presentable at some aspects. But there is a big problem in the ground reality that the patients or the victims, whosoever, they don't give their correct data. After a lot of trainings and lot of seminars we have attended to the patients, or even IEC activities have been done with the patients, and nobody wants to give their data because they are afraid of a lot of things. There are, as you told already. So how you, as from high experience, how you cope up with the to data correct and collected proper data from the ground and from the rural and other people. Most have the, like Punjab is the comparatively have a good health structure comparative to other states,
Yeah.
but still we can't affordable to the correct data. And what is your suggestion on this? So, what is opinion on?
So, if you remember, I mentioned this in my presentation. Having worked at, when I was in India, I have worked in NRHM for about 8 years, starting from the district level to the national level, right? And for a brief period of my tenure, I was in charge of M&E department in Gujarat. And what you
Okay.
are saying is the exact problem we have been dealing. What
Yes.
happens is, what we try to do is to train the ANM to get as much information as they can, at least the important ones. I gave you an example of patient's age, date of birth, right? There have been cases where a mother comes for vaccination and she is not able to remember when she delivered the child,
Yeah.
right? So we train the ENMs or the Anganwadi workers or wherever the immunization is taking place to ask them different questions. If they are not able to remember the age, we try to ask them, in India, when you go to a village, they will not remember the date, but they will remember those regional ways, like the tithis, and some kind of puja was there. That was there was a full moon that day, and they'll give you information like that. So we you have to train your the person whoever is gathering data to try different questions and at least take the relevant information that you will need at the upper level,
Okay.
right?
Yes. Thank you. Thanks, ma'am.
ओके ओके जस्ट अ मिनट
You are muted, I believe.
Yeah, Ruchi. Okay, we are so thankful, Ruchi. It was really informative, and it's really a great blessing and knowledge enhancer event session for us. And we are really looking forward for such kind of sessions again and again by you. But I think it's really difficult for you, and but surely whenever it's feasible, I will try to just organize it. And ma'am, you can give your LinkedIn link or something so that student.
Ma'am, I tried to find you, but I did not get your ID there. LinkedIn.
Uh, okay, just give me 1 second. Okay.
If it's not there, then you can share it with me.
No, yeah,
You can share it with
I'll
me.
share it with you, and you can
Yeah,
later
yeah, yeah,
with you the students.
yeah, yeah.
So you can. It's easy. Like, see here again.
Sure, no problem. I
That's what make you identifiable. There can be a number of Ruchi Mishras. Ruchi Mishra, Charlotte, University of North Carolina. That makes me identifiable.
correct.
The example, right? Try that way, you'll be able to find me.
Correct. So thank you so much, Ruchi, and we are really from Sci Institute, and there are 3, 4 other institutes are also associated with us. SGRR University is here, then CIMS is here, and DBIT is here. I invited students from 3, 4 different groups, and even students who are doing PhD with me and from HNB Medical University, Dr. Sukhbir from AIMS, some very good listeners we were having in our panel. So it was really
Yeah.
informative, and they were
You
through,
made me famous.
and they were present from the beginning till end. So it's really proves that it was really informative.
Thank you, thank
Yeah.
you.
So thank
And
you.
this is one topic that is huge. 1 hour is very less. There are different layers attached to it. So, any one of you, if you want to hear more about data analysis, data visualization, data profiling, or anything related to data science or data engineering, I'll leave my email address with Sir. You can reach out to him and you can just email me, and I'll be happy to answer your questions.
Thank you. Thank you so much, Ruchi.
Thank you.
Okay, now we would like to wind up this session here. You can get contact details from me. You can approach me. Okay, so thank you so much for a wonderful session. Good night to you, Ruchi,
Thank
and
you.
a very good morning
Thank
to all of
you.
you. Have a good day.
Right, ma'am.
Yeah, bye bye.
Thank you. Thank you.
Thank,
Bye.
bye bye.
Bye, everyone.